So, good morning everyone. So, today I'm going to discuss the sexual transmitted disease or STDs. So, it is a infection transmitted from an infected person to an uninfected person through sexual contact. STDs can be caused by bacteria, viruses, or parasites. Examples include gonorrhea, genital herpes, human papillomavirus infections, HIV/AIDS, chlamydia, and syphilis. So let's talk about some common STDs. So this may include chlamydia, gonorrhea, human papillomavirus or HPV, herpes, HIV, syphilis, and trichomoniasis. So let's start with chlamydia. Chlamydia is a bacterial infection that can cause discharge, pain during urination, and other symptoms. So basically, chlamydia is a type of STDs in which the infected person is facing the pain during urination, and it has symptoms in men: pain when urinating, also white cloudy or watery discharge from the tip of the penis, also burning or itching in the urethra, the tube that carries urine out of the body, and lastly pain in the testicles. In women, they have this more symptoms than men. So they have in women they have pain when urinating, unusual vaginal discharge, also pain in the tummy or pelvis, also pain during sex, bleeding after sex, and lastly bleeding between periods. Now let's talk about the gonorrhea. So gonorrhea, another bacterial infection that can cause similar symptoms to chlamydia. So gonorrhea is a sexually transmitted disease that caused by infection with the Neisseria gonorrhoeae bacterium. So gonorrhoeae infects the mucous membranes of the reproductive tract, including the cervix, uterus, and fallopian tubes in women, and the urethra in women and men. And gonorrhoeae can also infect the mucous membranes of the mouth, throat, eyes, and rectum. So if you try to observe the symptoms of gonorrhea and chlamydia, so it has almost the same symptoms, because in women, in chlamydia, they have this an unusual vaginal discharge, which may be thin or watery and green or yellow in color. Next is pain or a burning sensation when passing urine. Also pain or tenderness in the lower abdominal area. This is the less common. So next is bleeding between periods, heavier periods, and bleeding after sex. Also, when it comes to men, the symptoms of gonorrhea in men is they have an unusual discharge from the tip of the penis. Also, the symptoms in men when it comes in gonorrhea is they have an unusual discharge from the tip of the penis, which may be white, yellow, or green. Also pain or a burning sensation when urinating, inflammation, swelling of the foreskin, and lastly pain or tenderness in the tentacles. So next TDs is the human papillomavirus. So it is a viral infection that can cause genital warts and is linked to several types of cancer. So HPV does not usually cause any symptoms. Most people who have it do not realize and do not have any problems. But sometimes the virus can cause painless growth or lumps around your vagina, penis, or anus. Nevertheless, in some people, some type of HPV can cause genital warts, abnormal changes in the cells that can sometimes turn into a cancer. So what are those cancer? So these are the cervical cancer, vaginal cancer, anal cancer, penile cancer, and lastly the vulval cancer. Next TDs is the herpes simplex virus. Herpes, it is also a viral infection that can cause painful blisters or sores on or around the genitals. So in HSV, most people infected with it don't know they have it. They may have no symptoms or have very mild symptoms, but the symptoms is about to start within 2 to 12 days after exposure to the virus. So this may include pain or itching around the genitals, small bumps or blisters around the genitals, anus, or mouth. Painful ulcers that form when blisters rupture and ulce or bleed. Also, scabs that form as the ulcers heal. And also, painful urination, discharge from the urethra, the tube that release urine from the body. And lastly, discharge from the vagina. Also, they have different symptoms location. So these are there are differences in symptoms location. So source appears where the infection enters the body. You can spread the infection by touching a sore and then rubbing or scratching another area to your body that includes your fingers or eyes. So sore can develop on or in the buttocks, thighs, rectum, anus, mouth, urethra, vulva, and vagina. So next STDs is the HIV/AIDS. So this is also one of the common STDs that we have. So it is a viral infection that attacks the immune system and can lead to AIDS, condition that makes the body vulnerable to other infection. So which means before AIDS, that infected person is going to face first the HIV until that immune system of that infected person will go down, and then it will go to HIV. So that's the way of HIV attacks the immune system of the infected person, and then it turns into AIDS. Next STDs is the syphilis. Syphilis is a bacterial infection that can cause sores or rashes on the skin and can lead to serious complication if left untreated. So in syphilis STDs, they have these 4 stages of the infected person that he will. So in syphilis, they have these 4 stages of kind of symptoms. So first is the primary syphilis, appearance of a single or multiple chances at the spot where the bacteria enter the body. For secondary syphilis, weeks or months after the channel heals, skin rashes and or sores or in the mucous membranes, mouth, vagina, or anus may start to form. Also, third stages is the latent syphilis, known as the late, hidden, or sleeping stage. The latent stage is where symptoms no longer occur. And last stages is the tertiary syphilis. It affects multiple organ systems, causing a number of health complications depending on which organ systems are affected. So lastly, the trichomoniasis. So lastly is the trichomoniasis STDs. So it is also a parasitic infection that can cause itching, burning, and discharge. So in trichomoniasis, the symptoms in women, they have this abnormal vaginal discharge that may be thick, thin, or frothy, and yellow-green in color, also producing more discharge than normal, which may also have an unpleasant fishy smell. Also soreness, swelling, and itching around the vagina. Sometimes the inner thighs also become itchy. And lastly, pain or discomfort when passing urine or having sex. So when it comes in men, so the symptoms in men of trichomoniasis is they have this pain when peeing or during ejaculation, also needing to pee more frequently than usual, and thin white discharge from the penis. And lastly, soreness, swelling, and redness around the head of the penis or foreskin. So that's all my report. Thank you, and God bless.